and welcome to the therapy room. Today we are going to do a hamstring treatment. So with the hamstrings, as you know before, you've only learned that the hamstring is the group of muscles behind the thigh. So today we're also going to learn the 3 individual names of each muscle. When you uncover a leg, make sure that one leg is always covered, because it's quite cold laying still. And another thing you need to ask the client laying down, you okay?
Yes.
Can I just tuck you in?
Yes.
It's quite polite to ask the client now to tuck them in, because they might wonder what you're doing, tucking the towel into the shorts. So here we have the leg, a hamstring injury. What we're going to treat today is a hamstring injury. So we're going to treat this as a tightness that happened during football training 5 days ago, and this could be grade 1 or a grade 2. So in order to establish whether it's a grade 1 injury, we will look to see if there is heat, swelling, pain, and we will check also the range of movement. The range of movement we will have done beforehand. She has told me there's no pain and the range of movement is fine, and she just feels tight. So we're treating this as a grade 1, and it's normally safe between 3 and 5 days. So this is 5 days ago, so we're going to go ahead. So the 3 hamstring muscles are, got the bicep femoris, which is the middle one, but it goes out to the outside of the leg. It attaches itself to the fibula. Then we have the semimembranosus and semitendinosus, both going on the inside. The medial side attaches themselves to the tibia. So that's something you need to learn and remember for the practical exam. So we're going to start. When you start a leg or a hamstring treatment, apply the oil and warm it up first. You always start with a hamstring. We're going to spread the oil first using the first technique, which is effleurage, just to spread the oil. But when you start going into deeper movements like pétrissage, which is what I'm doing now, which is the kneading, it's a good idea to treat the hamstrings or the upper thigh first, because that empties out any wastage, it does lymphatic drainage. So when we do the calf, this is already emptied out. So I'm going to use a variety of techniques. The pressure is okay?
Yeah, that's fine.
Okay, so first just make sure the tissue is warmed up, and then as I do the picking up, which is part of pétrissage and kneading, I also get hold of the adductor muscles. And adductor muscles are muscles that can get strained in a groin injury, and also if they are tight, it can affect the hamstrings as well. This is digital kneading. This stroke here is called palmar kneading. This is very good to use on the iliotibial band, because it stretches the band, which is often tight in any running type of sports. So now the thigh feels quite warmed up, so I can use a little bit of deeper techniques. This one is called knuckling. Always make sure that the client feels safe and that the towel is staying in the right place. Bit of digital kneading again. If you find any knots or any tissue that feels that there's some scar tissue, you can use a bit of friction movements. Always make sure you ask how it feels. So is that okay?
Yeah, that's fine.
Okay. A friction movement, the benefit of that is it aligns scar tissue. It also helps to stretch the tissue. Another stretching and also protecting your own digits is to use the ulnar border. So you can cover a large section of the thigh. And now I'm going to go down and do some effleurage on the calf. So sitting on the bed, this is allowed for this particular movement. Rest the foot on your shoulder, and then using the palms of your hand you can squeeze alongside each of the on the sides of the gastrocnemius muscle, and holding, so that always make sure you don't let this foot drop, because that doesn't help the client very much. So getting into the muscle by quite strong pressure and kneading. Another technique which is very good for tight calves is shaking. It relaxes and releases tension. And go up and shake the hamstrings. The reason why I'm doing the calf, even if it's a hamstring injury, is that everything is connected. The hamstring tightness is also connected to the lower back, but obviously if you're tight here, lengthening the calf muscle also helps to lengthen the whole muscle trains. It's called sort of trains going up all the way up the body. When you come down to the Achilles tendon, another tendon which is quite good to warm up and stretch and make more flexible, because that's obviously, if that gets too tight, that's something you can prevent any